Researchers at Johns Hopkins Bloomberg School of Public Health estimate 3 out of 4 people will be infected with Omicron before the surge ends. Joining us now to talk more about this stage we're at in the pandemic is Dr. Diane Hess, who's joining us once again. Thank you so much for joining us, Doctor. How optimistic are you at this point that we may be getting closer to a time where we're just kind of living with the virus as opposed to consistently making different guidelines and mandates?
You know, right now I'm optimistic, but nobody knows what the future holds. So we don't know if there's going to be another mutation that's going to cause it to be more dangerous again. In history, most pandemics do burn out by the virus becoming more contagious and less virulent. So that's what we're seeing with the Omicron strain. So hopefully this will just become another, virus, another viral syndrome that we're going to live with and learn how to deal with. And hopefully as more and more people become vaccinated, we'll have less repercussions of the hospitalizations and missing school and missing work.
Yeah, and so let's talk a little bit more about those mandates. We're seeing across the country lately, mask mandates are being lifted in certain businesses or even in schools. How do you think this factors into trying to reach this sort of endemic stage?
Well, personally, I don't believe the masks were really working very well for Omicron. I think the masks were extremely effective when the pandemic started back in March 2020. But as Omicron became so contagious and less dangerous, many people were relaxing their mask usage. I mean, I have patients who have to wear a mask who are 2 years old in New York City. They have to wear a mask to daycare, but then they take a nap without a mask. So they're all in the same room together. Does the virus stop being present in your respiratory droplets when you're sleeping? No, you can't enforce this anymore. It's not working. I think for children, the mask mandate should be dropped or be optional, personally. I don't think that it was very effective, considering that New York City has a very strict mask mandate, and almost, all of our patients who are unvaccinated got COVID between December and January.
Mm-hmm. And last time we spoke with you, Dr. Hess, you had some criticism for the CDC's messaging when it came to the booster shots. Now there's some other conversation when it comes to the messaging around masking as states are lifting restrictions more and more. But the CDC hasn't officially changed its guidance yet. What are your thoughts on what's going on there?
I just feel it's very politicized. I feel that they've dug their heels in, and then they don't want to change because of, these political affiliations they have, instead of basing their decisions on science. I mean, most infectious disease doctors, epidemiologists say that we can lift the mask ban now, especially for kids, when the repercussions of wearing the mask are so much greater. You always have the option as an adult or as a parent to mask your child, but to collectively punish a whole population of children who are not benefiting from the mask, they're still going to catch Omicron. What's going to happen is by the time the youngest children are eligible for the vaccine, probably in April, most of those kids are already going to have Omicron because it is spreading so quickly to the kids who are unvaccinated. So I just feel like they've dug their heels in, and they are very resistant to change, where other countries really, change as the science and, technology changes with it. I feel that the CDC has always lagged behind.
And that all being said, what are your thoughts on how we can make sure to keep immunocompromised people safe? I know you mentioned that you think masking shouldn't be required in schools, but what about places where people are more at risk of getting very sick or dying from COVID, even if they are vaccinated?
Well, you can say, like, in hospitals or healthcare settings, everybody has to be masked. That would be something fair to say. But remember, people who are immunocompromised are very immunocompromised for not just COVID. So they have to be cautious for things like flu or RSV or, any other virus. So those people can choose to still wear masks. I know when I say this, a lot of people get upset. I put myself out there and I get nasty emails and messages from people saying, well, my child is immunocompromised or my spouse is immunocompromised. The thing is that everybody needs to have a chance to get over this pandemic and to live again. And you can't collectively punish all the students in the United States when students in the Netherlands, students in Israel, students in UK, they all go to school without masks. And they're not, dropping dead like the media wants you to think they are. They're just getting, the Omicron virus, if they are getting sick, and they're sick for 2 or 3 days, and they go back to school after 5 days. I don't even think you have to be home for 5 days if you're not symptomatic, personally.
Yeah, well, I don't think not all media is saying that kids are going to drop dead if they're not wearing their masks.
No.
But I understand.
No, but
your point.
like it's a lot. It's not you. I'm sorry, but like I feel like people read the headlines and there's a lot of fear mongering, and that's been happening since then. And there's a small group of us that are vocal, and we get criticized, but we are the ones who are dealing with the kids every day. We are the ones who are taking care of the families every day, and we see that Omicron really hasn't been more. For kids who are healthy, it hasn't been more than a febrile viral illness with some croup. Yes, there is a very small percentage who get the inflammatory disorder, but still it's treatable. They're not dying from it. And we have other viruses that, are very dangerous for kids too, like flu, and that's why we give the flu vaccine. But we have to start evolving and changing our rules and mandates to meet the science.
Yep, and we'll see if the CDC does indeed change guidance moving forward. All right, Dr. Hess with Gramercy Pediatrics, thanks again for joining us.